Hi, I'm Dr. Vinay Chopra. I'm one of the primary care sports medicine doctors here at Seaview Orthopaedic and Medical Associates. I have one of my very lovely patients here, JoAnn C, who I've been treating since the year of 2014, so it's been about a couple of years now. JoAnn first came in to see me with knee pain related to osteoarthritis. And later on, she also came back to see me for her shoulder issues as well, due to rotator cuff tendinopathy and partial tearing, as well as some arthritic changes. Since 2014, I've been treating JoAnn with some viscosupplementation, such as Orthovisc. I've also tried conservative treatment options, such as physical therapy. We've also tried cortisone injections as well, and JoAnn has done very well, especially with the injections and with physical therapy. So JoAnn, if you don't mind, I do want to ask you a few questions about your condition, and maybe you can educate some of our patients here at the practice. So I guess going back to 2014, do you remember what caused you to have the knee pain, or what was going on at the time that caused you to come in?
Basically, it started out with the arthritis. I had a couple of falls, and it just increased. The swelling increased, and my cousin is a patient here, and she had her surgeries done here, and she recommended you. And I came in, and you started treating me, and it has been a whole different...
Great.
Really different world since you started treating me.
Excellent. Now, before you came in to see us, or came in to see me, what was it like living with the pain? Was it pretty constant? Was it daily?
It was constant.
Okay.
It was daily. It was constant. It was not sleeping. Not sleeping. And I wasn't able to exercise.
Okay.
And I wasn't able to sit very long.
Okay.
So it was difficult.
Okay.
Very difficult.
Was there a particular moment that you said, "Hey, I've had enough"? Was it the pain that just got unbearable, or was it a particular event that caused you to come right in?
Well, it was the last fall.
Okay.
I think was really, really bad when you found that it was like a little chip.
Yeah.
And that's when it got to a point that it was just really, really unbearable.
Wonderful.
For me.
Well, happy that you came in, and I'm happy we were able to get you feeling better. Now, we started off on diagnosing you with arthritis, and spoke to you about different treatment options that are out there. Obviously, we want to try to be as conservative as possible in the beginning and try to work our way up. And you ended up electing for the cortisone injection, also viscosupplementation, which is called Orthovisc. And tell me what your experiences was with the Orthovisc. Did you get relief right off the bat? Were you happy with the relief that you got from the procedure?
I was very happy with it. It took about a week for me to really feel it start to work.
Sure.
And it lasted, after my first series of shots, it lasted about 9 months.
Yeah, and then the average time frame is usually 6 months, so that's good.
It lasted very good.
Yes.
9 months was good.
Great, and so just to educate some of the patients out there, Orthovisc is a hyaluronic acid, or what we call viscosupplementation. It's actually a natural occurring lubricant that everybody has in their knees. When you start to develop arthritis, you start to lose that lubricant. So the thought process behind it is to put that lubricant back into your knee. So it does have a temporary effect, and it does last on average about 6 months or so. So in some patients it will last longer, so I'm happy that it lasts longer with you. At any point, did you have any concerns about side effects or anything like that from the injections or anything like that?
No, I was. If you would have told me there was going to be side effects, but I think you would have warned me if there was going to be anything, and there was nothing.
Good.
And you told me what to do. You gave me all my instructions, and I followed what you told me to do, and I was fine.
Wonderful. Yeah. So exactly correct. In terms of side effects, in some cases, not all cases, when you inject cortisone into any part of the body, there's always an increase of blood sugars, sometimes with people with diabetes, and also can have some adverse effects on the kidneys and things like that, but those aren't effects that happen all the time. And visco supplementation, very rarely do you have any kind of effects with visco supplementation. Usually you get a little flare-up of the knee, but it looks like that did not happen to you, which is great. And how's your quality of life today, especially with the knees?
It's so different.
Mm-hmm.
I am able to do 40 to 60 minutes on a treadmill.
Oh, wow, great.
I'm able to walk a mile.
Excellent.
And I couldn't do any of that.
Yeah.
And dancing is a passion. I went to my cousin's wedding and
Nice.
I danced all night.
Nice. I like that. Okay. All right. So I'm assuming you're very happy with the results that you've
I
had
am
so
very
far.
happy.
Okay, great.
Very, very happy.
Excellent. Good.
And I appreciate you very much, Doctor.
Thank you.
Being patient with me. The shots are, you get a little frightened at
Yeah,
first.
of course.
And even though you say that here comes a little pinch, it's not always just a little pinch. But it's really, I have to thank you for a lot.
I appreciate that. I've been also treating JoAnn's shoulders as well, which she also responded very well to. We've tried therapy on her. We've tried cortisone as well, which once again has helped her. It's sort of the whole point of this thing here today is to point out to people that there are conservative and non-surgical treatment options available, and in most cases, non-surgical treatments do work, and you are an example of how this can work. Well, I just wanted to thank you for coming in. Did you have any advice to your fellow patients or anything like that?
Well, if they're hesitant to come in, I think they should. They should not be. I think they should come in and try.
Great.
I think they should take a chance. I know I've recommended. You have a new patient, Gloria.
Yes.
I just recommended it to you.
Thank you.
And
I've been treating your husband as well too.
Yes,
I
mine is for his hands.
Yes.
And that's worked very well for him.
Great.
And I think these people should give it a try.
Awesome.
I think they should come in, give it a try, and it's worth it.
Excellent.
It's worth it 100%. And I thank you very much.
No problem. Anytime. Thanks for coming.
Thank you, Doctor,
Thank you.
for everything.
All right.